Pleasure to be with you today. My name is Jesula or Mrs. Maslin. Call me the way you want to call me. You know, I don't mind. Since I hear my name, I will answer. This is my biggest problem.
What is your name? If you say they can call you the way that they want,
I don't hear you.
I don't know.
Oh, now I can hear you.
Yeah.
Yes, I want to say good morning. Moi, nous voulons dire bonjour avec tout si la yo qui branche réseau pa yo à Pistas FM. Good morning, Boca Raton, Fort Floor, bonjour. Et je dis là, nous gagnons et Monsieur Prien avec nous qui boide parce que ça me connaît, qui bol penser le bras là. Comprendre? Li boide.
Je vais le marier.
On va le marier? D'accord. Bonjour Monsieur Prien, comment est?
Good morning. I'm okay. Good morning to everybody. Welcome on board. As always, we are pleased to be with you this morning to serve you in this show, Stars Family Support. You know you are a member of this family, then you must be part of the show. We want to hear from you. You need to come or make your phone call, send your message, send your questions, and then Mrs. Julie, my next wife, that we have the wedding today.
Oh, the wedding is today?
Today, yeah. That's why I'm like that.
Oh, okay.
Our wedding is this morning, okay?
Okay.
N'a pas invité mon boucaille au vin fait là après parce que n'a fin marié matin n'a invité au vin réception.
Monsieur grand-mère nous.
Yes, okay. N'a pas invité Chantal mais Chantal c'est après n'a fait réception.
Oui, après.
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 Everybody, as I said, good morning, welcome on board. Mrs. Judy, how are you, darling? How are you doing?
I am doing well, thank you. Good morning, and thank you to everybody. Thank you so much for having me back.
No, that's how it's responsibility. This is your radio TV. This is your studio. That's your show. No one is having you back. No one is receiving you. You come back to your studio. You come back to your show.
Nous voulons dire bonjour avec Julie. C'est un plaisir pour nous gagner encore et sous radio ça
en
blanc créole. Oh, c'est Gemina. Bonjour chérie. Vous êtes là, ça veut dire c'est Gemina qui est en beauté. Alors, si vous ne pas saluer, c'est parce que Dieu me pas dans écran, s'il vous plaît. Parce que il y a des gens qui comprennent qui dit comme ça que yo monter me pas saluer yo. C'est si moi les yeux me regarder et puis moi well et puis moi tout saluer mon.
Il faut dire mon yo gon façon et que bah travail ça que n'a fait là mes amis tellement compliqué, tellement mandé nous. Là, nous ri, nous bail petit blague, c'est pour nous courir des stress, travail ça, pour nous responsabilité parce que nous avons façon pour nous être dans le studio, nous pas qu'à virer tête nous à gauche à droite, caméra sous nous, on va nous là alors qu'il faut virer sa capacité computer, nous avons laptop devant nous, nous avons 2-3 téléphones là, il y a un cap madame qui ça va faire comme si toujours manger ou tant qu'on petit monde qui des autres, pas petit monde. I'm not that kids, but you know, because of my responsibility, because what I'm doing, because the job that I have, I got a lot in my plate. That's the reason why you
can stay one place.
I cannot. I have to leave the studio, go to the office, come back. It's not my fault. Okay, please forgive me.
Okay, nous voulons dire bonjour avec tout. Oh, nous allons voir l'église de la Chambre Haute, dans Damna. Nous espérons que sujet ça qui va parler aujourd'hui, c'est un sujet qui est très intéressant et qui intéresse, même Jean-Monsieur Prien t'a dit, il intéresse tout le monde, femme ou garçon. Parce que dans le papier, ça me fait appeler là, moi, les garçons, les gars.
Bon, mais même, il y a un problème net. Je vais l'expliquer, je ça. Côté le jeune avec deux, c'est ça, le mettez pour garçon.
Ou pas,
ou pas contre côté le jeune avec bagage ça.
Ah, c'est pas lui.
Non, c'est lui-même. Elle faut expliquer. M'accuser le matin. Ouais, Bamdou, pas commencer à gâter mariage, s'il vous plaît. Pas commencer à gâter mariage, non,
c'est pas qu'on fait mariage qui te gâter.
Non, vous voulez vous gâter mariage le matin, là. Julie, mettez un bagage comme si m'galgue que côté m'galgue que c'est dans tes là. Ça n'a fait comme ça.
Non.
Et Julie.
Bonjour tout le monde, c'est comme ça nous entrer la caillou avec le rire, comme nous toujours disons que rire c'est une grosse thérapie et il agit sous mémoire, sous cœur, sous toute partie dans corps. Ça veut dire que lorsque un petit calme pour rire, un petit calme côté pour rire, just do it. Il y a des gens qui payent comme pour y faire ça. Ou aujourd'hui à nous bailler gratis. Bonjour Julie. Bonjour Madame Julie. Bonjour. Good morning. How you doing?
Good morning. I am doing well. This morning I want to talk about breast cancer. This morning I want to talk about breast cancer. And breast cancer is very common, is very common with women, but you could find it in men too. You could find it in men too. So breast cancer is cancer of the breast. Okay? That's cancer of the breast. So for women, when we are, we start developing naturally our breasts, women after the age of 30 have to start self-examining themselves of the breast cancer. So first of all, let's talk about what is breast cancer. Breast cancer, first of all, is cancer of the breast. There's different types of cancer of the breast. Okay? There's lobular breast cancer, which is in the part of the breast that produces milk, that type of cancer. There's cancer in the ductal situ, which is another section of the breast, which they call it ducts. And this is just those type of different breast cancer. There's different names and different types of breast cancer. There's called triple negative breast cancer, inflammatory breast cancer, and Paget's disease breast cancer. Either way, yeah. So I just want to say, I know this is a lot of information about the different types of breast cancer, but I want to really focus on not specifically the types of breast cancer, but just breast cancer generally as a whole. So many people ask, what are the symptoms of this type of cancer? Common symptoms of breast cancer is when there's a change of size, shape, or even the contour of the breast. So ladies, after we take a shower specifically, it's important that we look at our body. It's important that we look at our breasts and be familiar what it looks like, because it's very common when we may be the first ones to notice that there's a difference of size. One might be bigger than how it used to be. It might be more tender, it might hurt. The skin may look a little different. Okay, there's a difference of the skin, or even the nipple may look different. And those are common symptoms of just like a visualization of the breast. Other symptoms include a lump or a mass, right? Where you feel like on boule inside of the breast, okay? That's abnormal. Another part is that you could feel like a mass underneath your armpit that's near the breast. That's a very common area to have it. Another symptom of breast cancer could be discharge from the nipple, like bloody discharge. It's very abnormal because, number one, it's never normal to have bloody discharge from your nipple, right? And or clear discharge from your nipple, clear liquid too, especially if you're not postpartum, if you didn't have a baby. You shouldn't have anything coming out of your nipple, okay? The only time that it's normal for milk to come out of the nipple, as we know, is after having a baby. After that phase of life, nothing should be coming out of the nipple. That is not normal. So let's talk about the causes of breast cancer, okay? There's many different factors that is the cause of breast cancer. First, age of being 55 years old or older. Women are more likely to develop this condition than men, even though women are most likely to develop this condition, but this can also affect men. Okay, there's a small percentage, I believe it's about like 3% of all breast cancer is from men. but it is something that can happen to men. Another common cause is family history. If your mother had breast cancer, any of your siblings, aunties, any of your family member, like close family members, had a history of breast cancer, that's important to know, especially if it's your mom or your grandmother, because it has a strong family history cause. Genetics. Genetics, it says up to 15% of people develop breast cancer because of genetics. And that has to do with your family history. If your mom had it, your grandma had it, that's because of the genetics. Other causes that we can control is smoking tobacco, like smoking cigarettes, or drinking a lot of alcohol can contribute to it. Being obese, being overweight can contribute to it. And other causes could be radiation exposure. Now, radiation exposure is commonly found with people who may work in an area with radiation. Like if you work in the hospital and you work in X-ray, you work in CAT scan, or if you work in a lab where there's a lot of X-ray and radiation exposure. That's usually the type of people that have a lot of radiation exposure and they're affected by that. The complications, yes, this is heavy. So with breast cancer, how is it diagnosed? So first of all, the first diagnosis comes from a doctor. When you go to your doctor, okay, you can go to your primary doctor or your gynecologist. And then when they perform a physical examination and they feel something abnormal, they will order a mammogram for you to have done. And then you can have a mammogram, you can have a breast ultrasound. And if the mammogram and or the breast ultrasound shows that you may have a lump or a mass in your breast, the doctor's gonna order for you to have a breast biopsy. And the biopsy is when they take a little piece of that mass and then they send it to the lab and examine it to see, number one, if it is cancer, and then number two, what type of cancer it may be. And the purpose of that is to know, because we discussed different types of cancers. The reason why there's different types of cancers means that there's different types of treatment. So once cancer is diagnosed, there's something called cancer staging system. Cancer staging means that how bad is it? And for cancer of the breast, there is 4 stages. There's stage 0, which means that the disease is invasive, meaning it hasn't spread anywhere. It's actually small and is very easy and quick to treat. There's stage 1, where it is cancerous and it starts spreading in the tissue. Stage 2 starts spreading a little bit more in the lymph nodes. Stage 3 starts spreading even more past the lymph nodes, and then stage 4 means that that's the worst stage, and that means that that cancer has spread to other organs like your liver, your lungs, your brain. That means that the cancer started in your breast, but now it has spread in other organs. Now, how do we treat breast cancer? It depends on the type of cancer you have, and it also depends on how bad the cancer is, meaning the stages. If the cancer is just in the breast, it hasn't spread, and it stayed in the breast, then the doctors will say that let's just do a mastectomy. A mastectomy is when they remove the whole breast. They either remove one of them, or they may remove both of them. That's what you call a mastectomy. Another procedure is called lumpectomy. Lumpectomy means that if the cancer is in a lump or in a mass, meaning it's in a ball, right? And the doctor will say, well, we don't have to remove the whole breast. We can just go in and just remove the cancer and leave the breast. That is what you call lumpectomy. After having a lumpectomy, many women have breast reconstruction, meaning that they try to fix their breast to keep their breast. And for women who had a mastectomy, meaning that they removed the whole breast, they may want to apply breast implants. Breast implants so that they can have breasts again. Other type of treatment is chemotherapy, radiation therapy, hormone therapy, immunotherapy. Those are other type of treatments to pretty much treat the cancer. And for this type of cancer, it could be treated more than one way. Some, depending on how bad the cancer is, how much it's spread, some women still have chemotherapy, and they eventually have the mastectomy. They may do both, and that depends on how much it has spread. So the reason why breast cancer is so important to know about and to talk to each other about, for us women, so we can talk to our friends, we talk to our mothers, our aunts, our cousins, we talk to our daughters. The reason why this is very important to talk about and to know about is because information is key. And many of us, we get our information from each other. And when we're together and we talk about, oh, did you know Grandma had breast cancer? We know Grandma died already, but Grandma's sister had breast cancer, or Auntie had breast cancer. Things like that, that's good information to know, because many of these cancers have a very strong genetic component. So the more information we know about our family, the more information we know how to take care of ourselves. How to, when we go to the doctor, to ask them to evaluate, to look for these things. You know, and because if we do not go to the doctor and we do not know or even try to evaluate for breast cancer can take your life if it goes untreated. So if you have the breast cancer, you don't know you have it, or by the time you find out that you do have it, it has spread very far in your body, and it becomes stage 3 or stage 4, it can take your life. And unfortunately, it has taken too many women's lives. And that's why this topic is also important to discuss with men, because we know mostly it affects us women, which is true, but it affects more women because we have bigger breasts, right? But men have the same anatomy, but of course it's not the same thing, right? But it's important. 3% of men are diagnosed with breast cancer. 3% sounds small, but it's 1% too big. So it's even for men. The same rules apply. You know your body. If it looks a little different, you're feeling your chest, you're feeling something hard, nothing hard should be there. Talk to your doctor. Know your body too. But most importantly, know that breast cancer can affect men too. It can. So, prevention. How do we prevent breast cancer? Breast cancer, first thing is finding out, is doing self-examination. For women, we can do our self-examination at home, in the shower. When you're in the shower, touch your breast to see how it feels after you're taking a shower or during the shower, to be familiar of what your breast feels like. So if there is a change, you know. That's number one. Also, when you go see your doctor, when you go see your gynecologist, which you should see your gynecologist at least once a year, go see your gynecologist and allow them to do a breast examination. Same thing for your primary doctor. They can do a breast examination too. And once you're the age of 50, doctors recommend for you to do a mammogram. Mammograms, I know, is very uncomfortable, but once you are at the age of 50, you can have a mammogram every year. If you have family history of breast cancer, you can have a mammogram way before 50 years old. You can have a mammogram at 40 years old. And you can start having a mammogram at the age of 40 once a year if you have family history of breast cancer. So prevention is more self-examination, going to the doctor, making sure that the doctor checks this, examines your breast, and then also lifestyle prevention, eating healthy, exercising, not smoking, don't drink a lot. Those are lifestyle things that we can control. But it's more, but it's just really just informing ourselves, doing self-examinations, going to the doctor. And that's what that is about. So going back to just with the breast cancer, just remember this affects men and women. We could talk about it amongst our community. There's a lot of us that doesn't know about this. And when we go to the doctor, ask the doctor to examine our breast and talk to our family members if it runs in our family, because information is key. Thank you.
Thanks to you, Sister Gisela. Take it over.
Yeah, nous voulons dire merci avec Miss Jolie. And alors, nous faisons juste un petit râler sur ça avant que nous posions Miss Jolie question qu'on ait des gens qui Haïti qui va vraiment en anglais.
Maîtriser langue blanc.
Maîtriser langue
Il y a
blanc.
un blanc qui va le traduire pour eux.
Qui témoin
Un
répond.
blanc en créole pour le traduire pour eux. Un blanc créole qui t'attend dans l'autre créole blanc.
Alors,
qu'on a traduit pour le peuple là.
Miss Julie t'a parlé de cancer Nan Tete et qui s'allie comment qu'on ka reconnaître li et qui type de traitement que yo fait pour cancer Nan Tete. Il dit comme ça que en un mot, alors c'est pas une question mieux parce que on connaît alors bon pas précipiter. Ça veut dire que moun nan le que ou doit compter tout. Si ou ta wè que ou gen yon 10 choses, ça veut dire que c'est yon bagay qui a sorti dans tête ou sans que ou pas faire allaitement, OK? Et puis ouais soit gen yon de l'eau, tant qu'on bagay tant qu'on lait ou du moins tant qu'on yon sang qui a sorti ou doit aller ouais docteur. Et il dit comme ça que pi bonheur que ou capable remarquer que vous avez breast cancer, c'est plus bonheur que vous capable prendre qui capable aider vous pour capable faire prévention et prévention c'est lui-même qui va aider vous. Et puis faut que vous checker TTA pour garder pour est-ce que ou pas gagner une boule la donne, est-ce qu'on pas un petit masque qui peut-être un petit grain poids ou du moins tout est-ce qu'on pas gagner ou pas senti que vous gagne une boule qui plus ou moins en bas bras et qui tout près avec TTA et quel que soit ça qui ou trouver qui pas normal et ou senti dans TTA ou doit aller ouais docteur et puis il parle tout de type ça veut dire que gagner 3% garçon tout ça veut dire pour garçon pas comprendre que yo fin rive net ça veut dire gagner environ environ 3% garçons qui frappé par breast cancer, il dit comme ça que ou te ka dit 3% li petit mais même 1% est trop. Ça veut dire que ça connaît. Ça veut dire que au moins 3% garçons et il parle de génétique. Génétique là c'est le par exemple maman ou fait une maladie ou bien grand nous et des fois nous connait grand-mère nous qui mourit et gen moun qui fait qui pas connaît grand-mère avec grand-père. Ça veut dire que souvent surtout pour nous même qui sorti Haïti en dehors nous pas qui ça tuer moun. Nous était là on était compliqué de mourir. Des fois on dit c'est diable qui mange mais c'est pas vrai. Ça veut dire que les génétiques là c'est là que parents ont été fait mais il te parlé plus de parents parents côté maman parce que li estimé que li plus strong toujours que les blessés bon pas bon mais tous les deux toujours dangereux et puis il dit que yon femme si toutefois que ou ta gen yon moun dans famille on qui te fait cancer du sein ça qu'on gen pour faire ou doué et ben tu commencé faire mammogramme depuis à l'âge de 40 ans si m'ba trompé ça veut dire que ou fait li pour capable déterminer exactement qui ça gagne avec qui ça pas gagné et puis il dit comme ça que type de traitement yo fait type de traitement yo fait bon bah on qui j'ai pour me dire ça en anglais en créole non mastectomie hein, ça veut dire c'est retirer OK c'est retirer TTA mastectomie hein, c'est retirer TTA net parce que gen moun li kon fait cancer du sein li kon pas décider pour li retirer alors c'est une question que me pral poser Miss Judy tout très bientôt est-ce que yon moun ça pral dépend de qui saz que moun li doit retirer TTA ou du moins tout et est-ce que le moun n'a pas retiré là est-ce que li gen chance pour cancer ça tourner et s'il retire le net tout est-ce que pas gen chance pour lui retourner c'est pour une question yo et puis il parlait de ça qui relait en lumpectomie bon pas connaît ça li même alors lumpectomie en Miss Julie ou ka font tirer aller sur lui encore pour nous
yes so lumpectomy ça veut dire comme ça le cancer rete non petit boule li pas marché li juste rete non petit boule so ou fait choix pour docteur retirer boule là ou kembe TTA okay but mastectomy is no retirer TTA net
OK. Ça veut dire que li dit comme ça que lumpectomie c'est le par exemple yo wè yon petit boule dans TTA et que docteur a doit proposer pour dire comme ça que est-ce qu'on veut retirer seulement petit boule là côté le chita et puis ou kembe TTA ou du moins tout est-ce que vous voulez retirer mais des fois tout ça va dépendre de gravité parce que gen ça qui relé stage 1 stage 2 and stage 3 and I think they also go up to stage 4 ça veut dire que gen une gravité que le rive ça veut dire pas gen choix obligé retirer le net mais
avant d'aller plus loin est-ce que cela veut dire que les retirer le net là moun sa li hors de tout danger
c'est non c'est pas une question pour Miss Judy m'a fini expliquer mon et puis n'a poser question et puis il était parlé de aussi de breast reconstruction c'est les moun nan li d'accord pour remettre TTA même qu'on a gen moun tout li tout rete avec espace là li pas bagay et puis il dit comme ça que pour moun qui a travaillé dans une série de métiers n'a professé tout le temps ça veut dire que yon moun qui travaille dans get treatment qui c'est chimiothérapie tout que yo fait que nous capable comprendre qui plus courant nous quoi radiation nan tout pas vrai Miss Julie
so chemotherapy sont chemical mettez en dans corps and then radiation therapy so on courant
OK
c'est ça qu'on courant
OK
yeah.
Yeah. Ça veut dire que moun qui a travaillé côté que yo fait X-ray. Ça veut dire que dans une série de gros machines qui ont une série de rayons X, pas vrai, Prien?
Bien sûr.
Yeah. Qui ont une série de rayons que y a peut développer en dedans pour yo faire examen ça. Et c'est une raison qui fait que le yo moun a fait test, yo toujours demandé est-ce que on fait des tests, yo toujours demandé est-ce qu'on enceinte.
Yes. Parce que machine ça qui ou pral passer ou là-dedans ou bien rayon ça yo, il
pas
est capable d'affecter
ti
ti moun,
moun
il pas bon pour lui.
Yeah.
Parce que ti moun qui fait avec conseil de dommages, eh bien tout ça yo fait partie de ensemble risque que maman te courir dans arrêt à côté que te en endroit à côté que la travail à côté que qu'on passer, on sait de bagages qui la cause ou pas même cell phone qui dans mon nom, yo tout ça, faut qu'on peut avec lui parce que on pas comprendre, il y a un pile rayon traverser.
Yeah. OK, ça veut dire que li parler de ça veut dire protection et c'est une raison si ou pas une raison qui mande au pour PD faire X-ray on série de tests il pas nécessaire pour d'engrien pour PD faire et c'est une raison des tests ou fait ça pas dépend de qui j'en lié ou commander un disque ou commander résultat pour sous pral côté un autre docteur ça veut dire pour capable présenter avec un disque et puis il parlait tout de gen on hormone thérapie tout, il t'a parlé de hormone thérapie, ça veut dire que tout ça yo c'est traitement, mais ça veut dire gon série de endroits que on travaille, li mandé pour prendre des précautions, ça veut dire pour capable protéger tête ou moi crois que dans côté ça yo gon série de gros bagaille, yo kon ba moun nan mettre sur lui pour capable barrer coller juste pour capable et bagaille. Avait dit
alors on a ça que nous y faut au travail mais al travail là il y a des endroits côté qui travail une série de risques et de conséquences par rapport à type de matériel que utiliser par exemple il y a des monde qui a travaillé dans le laboratoire monde ça c'est toute journée il y a un espace côté que il y a des traverser il y a des monde qui a fait qui responsable comme si machine monsieur je me fait un examen puis dame nan dit ah pas arrêter là avec ou non moi c'est vrai même pas acheter avec parce que machine ça c'est ou même avec seulement capable dedans là moi avec
on fait MRI
il y a moi avec nous nous le cercueil
of course parce que il faut wonder by life
nous le cercueil carrément on quitte ou même avec cercueil beaucoup pas bon mais Julie pas connait pour ça mon Julie choisi comme si nous de matin c'est des sujets ça pour parler pendant que moi me gagne rendez-vous ensemble avec lui OK monsieur Julie ou sur des questions me dit que moi une question moi été posée. Est-ce que les offres fait l'addition est-ce que les comme si on enlève si on retire take it away because it was affected that's mean the patient she or he has he cannot expect any problem.
Avant de lui répondre, n'a rappelé que pour auditeurs qui à peine branché yo, nous sur Pistars FM Radio Télévision et nous dans émission ça qui c'est Pistars Family Support qui présentait chaque lundi, chaque jeudi dans le ça mais nous toujours gagnons un topic que nous parler mais jeudi nous gagne avec nous madame Julie, c'est lui-même qui a présenté alors c'est pas un novice mais c'est un habitué parce que lui habitué fait des présentations là pour nous a parlé de breast cancer ça veut dire cancer nan tete qui s'allié prévention et traitement ça veut dire si ou à peine branché n'a dit que ou sur réseau pour la Pistars FM radio télévision Miss Julie you can speak.
Yes. So radiation, if a woman is diagnosed with breast cancer, there's always going to be more than one option for treatment. So if a woman decides radiation as a treatment, right, it's usually because si cancer a marché, right, in our lymph nodes. Lymph nodes we all have lymph nodes. And what lymph nodes are, it's an organ. It's a very small organ, and it connects all of your organs together. It looks like a string with a lot of little balls. But the responsibility of our lymph nodes is to connect our organs together, the heart, the liver, everything together. So if the cancer travels to the lymph node is a connection to other organs, it makes the cancer travel fast. So radiation treatment can be done to help prevent the cancer for it to travel. So ça veut dire comme ça, si on fait cancer de tete, cancer vient marcher in the lymph nodes, un traitement radiation. I think it's radiation ka aide prevent cancer ça pour pas marcher dans l'autre organe yo. But si cancer a vin trop grave dans organe TTE, then it's beneficial, li pi bien pour juste tout retirer TTE. Parce que sous quitter cancer là, sans traitement, la marche quand même. Parce que cancer marche.
Moi, j'ai une question. I have a question. Is someone may have cancer in different parts in the body without spreading? So all of them come by themselves, but it's not like, the one spread and then go to the other area.
No, là, moun gon cancer, pour exemple, si yon moun gon cancer dans colon, li gon cancer dans poumon, li gon cancer somewhere else, ça veut dire que ça cancer ça, li te commencé en côté. Li te commencé en côté, marcher dans tout organe yo. But li pas naturel pour un moun gon cancer in more than one organ en même temps.
C'est juste parce que nous gagnons moun, li te gagné cancer dans tête avant, et puis li gagné dans de l'autre côté, m'kwe dans pancreas, and also in her, I don't remember the other one. But c'est pas spread, li spread.
No, but it came from someplace. Cancer originates from someplace. And when it spreads, it usually spreads to the lymph node system. Even when it's treated, suge cancer na tete, and then you have treatment, it can come back. Any cancer treated can come back. That's why if it's like breast cancer and it's in lipoko mache, the doctors would say just do a mastectomy. Because it's easier just to retirer organe TTE instead of just treating it and having that chance to retourner. Of course, who get cancer in your brain, we can't take out our brain. So ça fait de certain cancers like cancer of the brain, cancer of your pancreas, cancer. If you have cancer in your colon, non pas in the colon, docteur dit que ça on just retire partie ça. And that's the same thing with your breast.
Okay.
Aïe,
You have a question?
Non, question mais li pas scary pour moi avec toute explication que m'attendais là yo. Qu'on y a la bonne chita sous prévention. Mrs. Julie, is there anything that anyone can do to prevent cancer, breast cancer?
The real prevention is to self-examination. That's a real prevention, because real prevention is what they call early detection. That's the biggest prevention. You do your self-examination. You go to the doctor and make sure the doctor examines you every year. Because if it does occur, it will occur small. It doesn't occur like stage 4. If it does come, if you do all of those preventions and you can catch it early, treat it early, and then that's it. So that's the best prevention.
You did talk about the causes.
Yeah.
Those are so many of them, different, correct?
Yeah.
Okay. Can anyone do something against one of those causes? For example?
Well, the biggest cause of breast cancer is genetics. That's the biggest cause, genetics and family history. But of course, other things that help prevent it, and it helps. It's like, a good diet, a good diet, meaning eating healthy foods. Red meat is not good for you. That's what studies show. Red meat is not good for you. So a good diet, exercise, not smoking at all. If you're going to drink alcohol, drinking alcohol very light, those are things that can help prevent it. But the biggest thing with breast cancer is genetics. Because the truth is, you can do all of those things. And if it's genetic, then it's going to happen. If it's genetic, because genetic is the biggest cause, to be honest.
Statistic for people dying or living with breast cancer.
Well, I can look up the statistics of the survival rate with breast cancer. But what I know that the survival rate, it says here, according in the year 2024, last year, it was approximately almost 317,000 new people, new women diagnosed with breast cancer. And it says in the United States, about 42,000 of them have died. So, and that's still a lot of people. So it says every year about 30% of women are diagnosed with cancer every year.
Oh.
And the ages, the common ages is women over 60 years old. That's very common in women over 55. But that doesn't mean it doesn't happen to younger women. It happens to younger women all the time. But for women that it happens, that's why it's important to know family history.
Simda capable simte connaît simda même pour me déterminer avant même que les causes problème m'da courir moi-même pour m'aider mesdames au fait toute prévention prendre toute précaution possible et imaginable et comme nous toujours dans phase côté que l'en malade depuis gen malade gen médicament nous toujours demander moun yo pour yo prendre médicament et tout depuis yo bon médicament ou gen thérapie pour aller faut aller en thérapie parce que moi gonzan même qui New York monsieur perdu madame ni et c'est là question nan te venu là li te gagné cancer dans yon sein yo coupé sein et puis qu'on y a là après environ 6 mois les gain problème yo vinn jeune là ka docteur l'autre qui t'a affecté ils font une deuxième opération.
Monsieur Jimmy gon question.
OK.
Plutôt relève relève tout.
Il va voir le bas OK. Oui.
I don't know if you want to talk. Il dit comme ça que question for Miss Julie. Even I won't be the 3%, I am just asking for other men who could have breast cancer. So the question is, we know there are a few men with big breasts, if they're obese or whatever. So let's say 90% of men have small or flat breasts. How the surgeons is gonna take it off. Okay.
Their body.
Yeah.
Mm-hmm.
That's a question
you
from
got it, Miss Julie.
That's someone who's in Massachusetts.
Mm-hmm. Jimmy.
Yeah, Mr. Jimmy.
Okay.
But it is
Okay, I'm gonna do it. Just let Mrs. Julie
yeah,
come with some explanation.
Yeah, Miss Julie, you can talk.
So yes, you're right. Men mostly have flat chests, right? They have breasts too, but it's flat. But for the men who are obese and they have more breasts, just because a man is obese and they have more breasts doesn't mean that, they are more likely to have breast cancer. No. It just means that they just have more breath. If they're overweight, clearly they're overweight, and that's never good for you anyways. But if a man has breast cancer, it's easier just to have the mastectomy. And the mastectomy is the same thing. You'll retire. So even though it's flat, but they still remove everything that's on the inside, and it will make it even more flat. So it's easier for a man to get a mastectomy. And sometimes I've had patients, male patients, who's had a mastectomy, and they remove everything, including the nipple. You know, and that's easier for a man, you know, emotionally and psychologically to go through than a woman. But just, yeah.
T'es sans tété? Ah bon, il me parle avec non. Hein?
Ok, il n'est pas tellement grave pour garçon parce que...
Comment il fait pas tellement grave là? Il pas mon moyen pour moi t'es sans tété?
Ah, ça... Comment
Bon, me pose question, dis-moi qui te m'a répondu. Je connais. Comme si là, on fait une opération, là, prêter sans tété? M'a prêté à un seul ou bien?
Well, you know, there's cosmetic surgery. The same way Theo can have breast implants. You know, men can have breast implants too. Of course, pas même j'avais si. Theirs is masculine, you know. But still, there is. You look like you go to the gym.
Okay, en tout cas, moi c'est
I don't know if I'm pas connais si monsieur Jimmy d'accord avec réponse élément réponse que Miss Jolie Bali. Mais question Pam, I used to hear that
Directeur là? Yes,
oh,
okay, monsieur.
Okay, let me ask my question before Mr. Jimmy. I used to hear, yes, Nathalie n'a mettons avec Miss Julie. I used to hear that, excusez-moi. Sorry, my people. Yeah, I used to hear like, you know, when a woman have kids and they do like breastfeed, and that can reduce the risk of breast cancer. It is true or not? Miss Julie.
No, it's not. It's not true that it reduces the risk of breast cancer. No, because then that's saying that if you choose not to breastfeed, that increases your risk of breast cancer, and that's not it at all. Many women, there's women once they get pregnant, you know, and that's when we go to the doctor and they check everything. A lot of women are diagnosed with breast cancer during pregnancy. You know, so, and it can happen. Yeah.
So because part of the 3%, so I have to work more. I have to do my part because I don't want them. I don't want Mrs. Julie come and then take away my tete. I don't want that.
Ok, nous allons quitter Monsieur Jimmy Vallée. Monsieur Jimmy, bonjour. Comment est?
Bonjour, bonjour, Prière. Et alors, disons good morning to Mr. Julie. I think she speaks Creole, but not really. Ça fait l'effet intervention-là en anglais. No, so I'm satisfied for the answer. But the first time I heard about it, men can have breast cancer, you know. But even I just said I don't think I'm gonna be in the 3%. No, never. People are gonna say you never know. But I was asking the question for other men eventually who can have breast cancer. So I say it's flat, it's small. How are they gonna take it off? You know? Well, she said that anyway they're gonna take it off. Alright, so c'est un bon bagay pour auditoire là et surtout les femmes et qui écoutent l'émission ça là et c'est des gens comme ça nous besoin pour intervention whatever domaine là depuis on connaît bien. Bravo Miss Jolie et puis on continue de nous. Allez, portez-vous bien. See you soon. Bye.
Alors, nous avons dit, nous pas vraiment fait en question de sexe, fille ou bien garçon, ou bien particulièrement fille, nous dit c'est monde de manière générale. Et comme dit que tu as dit, c'est la première fois que tu as dit ça, c'est pour ça, nous là, c'est pour ça, puis là, nous avons cherché information que nous ne connaissons pas pour nous partager ensemble avec eux et que nous gagnons des ressources. Mathieu m'a dit ça, cette dame-là, cette grande dame-là, je ne pas attendre pour moi que c'est ici, ils viennent faire choix chaque lundi ou bien every other Monday. Et moi-même, si c'était bon, toi, je suis content si je tous les 4 lundis ou bien si c'est 5. Je suis retiré, je suis content. Mais if that happens, she can make it like every other Monday to have the show on Prestars to share her knowledge with the people. Moi-même, je suis vraiment content et je suis plus content pour les amis, pour les compatriotes. Et même les gens qui pas fait partie de la communauté haïtienne, qui fait partie de d'autres communautés, puisque Madame Julie, c'est un blanc haïtien qui est lié, et il parle anglais très bien, nous dit merci. Donc, il n'est pas venu pour dire la parler avec nos amis, nos frères créolophones, mais les anglo-saxons seront servis également. Then we will be so happy to have that opportunity. We'll be so happy to present to our community that opportunity. They can have somebody knowing what she's talking about, able to share with them her knowledge in Creole. But those who do not speak Creole, they will be able to be part of the show. Or then I will be pleased to have that on Prestars. So, moi, m'a campé là moi-même. Je vais quitter ce Jésus là continue toujours. Je ne connais pas si je le gagne tant encore pour lui faire plus. Il va être 11h30 dans quelques 2 minutes. Si on a quitté le parti, si lui-même il gagne d'autres activités ou bien il va plus de temps encore. Je pense que moins satisfait pour matin, mais c'est parce que je n'ai pas fouillé documents trop. Et pendant que j'étais là, je fait petit coup de tête, je fouillé, je fait petit coup de gel là-dedans, on $1 de la volée, font petit coup de gel là-dedans, mettez tête à terre, on dit, ça passe, monsieur, ça parle, tête à terre. Donc c'est ça.
C'est ça, esprit zombie.
Merci en pile, Miss Julie, pour le document. Hein? Ou quittez me dit ça m'a dit en connaît là pour me finir. Ouais, la fait choix ensemble avec nous, mais il préparer document. Li fait recherche li séparer ensemble avec nous, li aider nous gain document, nous gain outils dans nous gain information, nous pas un novice, nous pas égaré parce que li ba nous et pas nous venir avec nous, c'est lui même qui cherche information ensemble avec nous pour nous comprendre le respect qu'il gagne ni pour tête comme professionnel mais pour vous particulièrement nous même que li aider pour nous gagner document ça dans nous, c'est vraiment extraordinaire princess. I do not know how to express myself to show you my appreciation, my love, and my respect to you. Thank you for everything you have done. You keep doing on Prestars. As I said before, let me repeat myself. I'll be with you Monday.
If I supposed to ask Miss Julie a last question, it should be sometimes some people go to the doctor and they says your cancer is very aggressive. And then some of them slow, like slow moving, and some of them is just like that 1, 2, 3, and then they keep going up. So it is the person body make it like that, or there is a reason, or is the type of the cancer?
Yes. Good question.
And that's a very good question. What makes the cancer aggressive versus not aggressive is the type of cancer. That's what makes it aggressive. There's some cancer, it's not too aggressive. The pas marché, rapide, it stays in one place. Cancers like that is much better. It's easier to treat. And it's easier to treat, so it's more likely that you survive. So it's better. It's much better. But when the cancer, depending on the type, if it's an aggressive type of cancer, the marche rapide, and it causes great damage, right? Un pile dommage, rapide. That is more serious. But it depends on the type. It does not have to do with your body type. It does not have to do with your age. It has to do with the type of cancer.
Okay, they call it also slow killer. They says cancer is slow killer. I don't know if it's just because I don't know if you remember a lady who died a few years ago. That lady, she was, she was a coworker. I'm not gonna say her name. She was a coworker. She had a baby. After the baby, while she came back from, and then she fell in the elevator. They took her to the ER. They did all type of tests. They haven't seen nothing.
A sign of cancer.
Yes, and then she went home from after she was like hospitalized for a few days. They're sending her back home, and then after a few times she wasn't feeling good, and then she came back to the hospital. So they do all the tests. They don't see anything. But now they do more.
They're pushing it a little bit.
Yes, because they see like something must be wrong. They don't understand because she's sick, and then they find out she has colon cancer. And then I don't think from the time she had the baby, I think she was praying. I don't remember. It was like if it was the beginning of the year, she was praying God to have Christmas with her baby. Not even one yet. She's done.
Wow.
She was just 32.
Wow.
I don't think you were there at this time, but that happened. And
Let me see. Miss Jolie, because she that was talking about the time of the test, the exam that they did, like pushing it a little bit. Do you think sometimes that happen? Someone can go to doctor, can be in the hospital, but they do not pushing the test that they do, and then in this case they cannot figure out there is more than they see. There is more than what they see exactly. That could happen.
Yeah, that can happen.
Okay.
So when someone's presented to the hospital, and you're presented with we are presented with symptoms in the hospital, there's a list of tests that they will do. And sometimes doctors do miss things. They do miss things. And then when you go to the hospital and they don't find anything, but you still have symptoms, right? Because your body is still talking to you. You still have symptoms. They need to do more tests. They need to continue to do more tests because something is there. And then with her, I don't know who that young lady was because I wasn't there when that happened. So I don't know who that person was.
but you heard
But
about
is
it,
very
right?
sad.
You heard about it.
No.
Okay,
I never heard about it.
I'll talk to you in private about that.
Okay. Yeah, but it happens where you go to the hospital and then they miss it. And then it's like we have to talk. We have to, like, especially in our community, the Haitian community, we have to be confident to speak up for ourselves. If we don't feel right and the doctor's like, well, I checked, everything is fine, there is something wrong. The doctor needs to go back and he needs to look again. He has to look again. There's something wrong. And we have to have that confidence to say, no, doctor, there's something wrong. Check it again. Check something else again. Check it in this angle. And sometimes we have to go to a different hospital or go to a different doctor.
I was gonna say that too. Don't stay. I was gonna say that. Yeah. Mm-hmm.
Yeah.
Do not stay in the same place
Yes.
all the time.
Yeah.
But you say something.
Yeah.
Let's see if I can make a question or do I understand it. My point. Let's say, for example, I'm going to see my doctor. I said before, and then I have something that I'm not feeling well. They said, okay, what happened to you? I cannot sleep. Okay, when I ate, is what happened to me. My digestion is not working properly. And then they do some tests. After that, like 3 weeks, I go back to to my doctor, to see my doctor, and then come with the same problem. At this point, you do believe they must do more tests than they did before. I don't need even to ask for, correct?
Yes.
Okay.
Yes. And sometimes some doctors are lazy. Honestly, some doctors, it's the truth. Sometimes some doctors are lazy. They don't want to do the work.
Even with you, they get the money. Even they get paid for the job they do. Even they are the one responsible for your health. So they are lazy.
And that's a big danger. You know what? Sometimes I take your back, guys, because I see sometimes when something went well, they praise all the doctors. So they don't see the nurses.
No, most of the time.
You understand?
Most of the time.
But when something went wrong, because someone have to get the blame, the nurses didn't do their job.
They are the one to get the
they get the blame. Because it's a scale.
Yeah.
Higher you are.
More respect that you have, more money that you make,
and then
lower that you are, more responsibility that you put on your shoulder. Okay, less respect that they have for you, less respect, less appreciation that they have for
because
you. Unfortunately,
I can see for fact that the nurses, and guys, I love you guys. Sometimes they fight for the patient.
Yeah,
they're fighting for the patient.
Love them, but they do their job. They are part of the team. They know they have a responsibility.
Yes.
Okay. But as she said, I can understand some lazy.
Yeah.
I can understand them. Cause so what? I do what that I gotta do.
And the nurse are the one who fighting.
Yeah.
I see that all the time.
I give them the prescription, and then they have the medicine. I see them. I come to visit them, and then so what? But the nurse that working most of the time spend more time with the patient.
They know the patient.
They know. They see what is going on. Sometimes they even affected by what is going on because they spend more time with the patient.
They know the patient.
Understand better than you.
Yes.
And they need, I believe, those doctors, they're supposed to be the one that listening more. The nurses that working with them.
Yes.
Unfortunately.
Some of them have respect. Some of them.
Talking about. I do know. Come on. You know where I've been from, where I'm working with manager, with supervisor. I know.
Yeah.
When you go to the meeting, they don't see you that doing the job. They don't see you. Okay? Like carrying the bucket with the water.
Yeah.
Okay, because they are sitting in the office. Okay, they are sitting in the office, and then les pour prendre gloire, les big dog yo vini on prend, yo chita dans bureau et puis yo même pas connait qui ça qui va traverser.
Des fois moi nurse yo presque on pas presque goumé pour joindre une solution parce que ça ou du moins tout quantité médicament par exemple on patient dans EFIB ou dit ballon médicament li attrape la descendre est ce qu'il dans même niveau c'est pour qu'appelle mais sou dit quitter le toujours moun ça la pas gonflate là il allait pas comprendre
non Mrs. Julie I cannot take you enough darling as a professional but like for your contribution from what I know, from what I understand, from what I learn, I know you guys, you are doing a lot. People never understand. They never appreciate what that you are doing as job. I cannot take you enough, really. Thank you so much.
Oh. You're welcome.
Yes, Jojo, you can talk it and we're gonna be if you have to say something. Because I know you guys working hard. Yeah, and then
you're right. Because as a nurse, there's many times we have to fight with the doctors, and it's not right because they go to school and they're trained to take care of sick people. That's their job. They have to do their job. But as a patient, and I've been in nursing for a long time. As a patient, we have to be confident to speak up for ourselves too. Because I've seen in my experience, there's different types of patients. There's patients, they don't take no for an answer. I've noticed in our community, in the Haitian community, we trust doctors so much, which we should trust them. But when something is wrong and they're like, oh, okay, well, the doctor said there's nothing wrong, so okay, I'll just suffer. and you put your head down. And there's other community of people, they don't do that at all. They do not. They want an answer. They want to talk to the doctor. They want an answer. And I think it's important to have that attitude of, I want an answer. Anything the doctor does, any test the doctor orders, any lab work the doctor orders, any treatment, medication the doctor orders, it's important to understand why they're ordering it, to know why they're choosing what they're choosing for you. And if you're not comfortable or maybe you don't understand something, it's their job to help you understand. That's their job. You know, I respect doctors. The same way I respect nurses because we're trained professionals. But also it's important as a patient to know that you have rights too.
I remember
when something is not right, you could get a second recommendation. Go to another doctor.
I remember
Go to another doctor. Try Haitian doctors, try black doctors, try different
everybody.
doctors to get the answer.
You know, before we finish, I remember I had a heart, problem. They consult a doctor on my case, and then he came to the room. I'm in the hospital. He came to the room. Hi, how you doing? I said, I'm fine. Oh, they called me. They says you have da. And then I said, yeah. And then he said, this is my card. Just call to make an appointment. And I'm here in the hospital. Why don't you do a test?
Wow.
Yeah.
Why don't you do a test?
Yeah.
The last time I was in the hospital, Juju. So he just came in and said hi to me, and then they called me because to come and see you. Yes, just to come and see you. He don't even have a 1 minute with me, and then he said, you called to make an appointment to come see me.
That's so important for him. There is no why spending time with you.
I didn't
why?
I didn't go to him. I go to someone else. So I go to someone who care.
Why?
Yeah.
My goodness.
Yeah.
And then, do you know he sent me bill? Because he came not even for 1 minute?
Oh, he talks to
He
you.
sent you a bill? Of course he sent
Yeah.
you a bill. That's terrible.
Juju.
He was talking to you. You need to pay for that. He gives you, he passes you his card. You have to pay for that.
That's why, le nou fè emisyon sa yo, nou fè yo pou nou louvri zye nou. Nou nan fil la tou, nou pa ka di moun, bagay se doktor yo bon, mais logade wè gen yon ki neglijan, hey, run away. Because that's your life.
Yeah.
That's your life.
Yeah.
If you have your family in the hospital, you have to step up. You have to asking question, what is what? Why you doing that? Why you do that? And then why if that
Why
medication... why don't you do that? Ou du mes tou, pou ki sa pasyen nan apren, fami mna apren medikaman sa, li vin pi mal. Eske gon chanjman k dwe fet? Fok ou ouvri zyo, otherwise, moun ka mouri nan men.
Et nous pote konsultasyon pou yo, nous pote informasyon pou yo, nous pote eksplikasyon pou yo gratis, l'argent pou yo ta paye, pou yo al jwen yo, ok? Des fois yo paye l'argent yo pa jwen yo, tak ou ko ap di la. Den sinon, même nous voulons comprendre et que nous travaillons avec nous, nous travaillons pour nous, émission ça pour nous tendre, pour nous participer. Nous pouvons remercier et nous féliciter une autre fois encore Sister Ibenal qui était là avec nous. Nous pouvons saluer With Love, nous pouvons saluer Tracy Jonas, nous pouvons saluer Linda Sadou, nous pouvons saluer Charlie. Donc nous saluons tout le monde qui était printemps. Nous saluons M. Jimmy qui était là tout. Ouais, religieusement, M. t'a suivre. Donc nous disons merci à tous ces là pour nous comprendre l'importance du travail que nous avons fait. Nous remercions une autre fois comme Madame Julie. Même comme moi dit nous avons cherché côté que nous avons cherché professionnel yo, si là qui dispose d'un minimum de temps que vous capable bail, c'est eux qui veut renforcer l'équipe là, nous avons l'autre docteur qui veut venir. Bon si nous avons fait émission à caractère santé chaque jour ici,
parce que
nous avons différents types de médecins. Je ne sais pas comment que vous aider nous, l'autre médecin que vous connaissez qui gagne un petit temps que vous capable, nous l'autre amis que vous connaissez qui dans fil là, l'autre nurse qui même avec ou qui pratique l'autre branche, bébé, so please I'm begging you find out now ou a fait démarche pour nous. OK.
Spécialement pour communauté haïtienne.
Ou a fait démarche pour nous. OK Dudul. Menez yo vini faire show avec yo chita avec yo inviter yo venir avec yo là parce que studio c'est pour les radio c'est pour les menez yo vini chérie. We cannot wait to see you and bring more people parce que nous besoin yo. OK? Nous connaissons que nous avons des cop
Ok.
pour nous payer, nous pas de cop pour nous payer. Service ça que vous rendre à la communauté, c'est ciel là qui remet tout, c'est lui qui paye. Mais please, as much as you can, more people than you can find, more professionals like you that you can find, and then to build a great team and to come here, Jujul, I cannot thank you enough, princess.
Eh bien, Miss Julie, nous avons demandé pour capable faire salutation. C'était un plaisir pour nous être ensemble avec vous. Et je crois que Pistas là, prêter bouche palme avec bouche Monsieur Prien pour nous dire un gros merci. Et nous connaissons que c'est temps où nous prend, comprenez, nous prenons temps ou offrir tout. Parce que c'est où même lui qui me dit comme ça qui n'a fond bagaille.
You see that?
Ça veut dire c'est lui qui offre tête lui. Vous comprenez? Ça veut dire ça tient ma cœur en pile. We want to say thank you to you and thank you for your to your parents. Vous comprenez? Who was helping you to be the person you are today.
Yes.
And you can put yourself in service for our community.
She's too sweet.
Yeah.
She's too sweet.
Yeah. Jojo met parler oui pour nous pas nous finir.
No, that's really, so I just want just to let everybody know, make sure when you go to the doctor, women, get your breast checked. Once you turn to age 50, make sure you get your mammogram. If you're younger than 50, at the age of 40, make sure you can probably get a mammogram every few years, but learn self-examination, talk to your family, talk to your friends, spread the information.
Okay, thank you, Monsieur Prien, thank you to
Thanks
everyone.
to you invite me at your show.
Ok,
Thanks to
merci
you.
tout le monde. C'était Pistas Family Support qui était la caillou avec Madame Julie qui était portée pour KISA qui breast cancer et nous sommes contents pour nous te recevoir dans le studio Pistas FM et nous dit merci avec Monsieur Jimmy depuis Massachusetts, Mission Massachusetts et nous Madame Katia Valmont-Désir. Il y a par contre ça passé. Mais nous dit merci
qui parle la matin peut-être travail l'école. Bon samedi Monsieur Major il parle la matin.
Yes.
Mais en tout cas comme on connaît
non, il y a pas le
c'est ça qui Pistas, c'est ça qui surtout Pistas Family Support. Les nous dit on nous fait combit pour nous planter.
Voilà, on nous fait combit pour nous planter. Et un jour va arriver à récolter. Si nous fait combit pour nous planter. Et un jour va arriver à récolter. Semaine en main, main en main. C'est ça qui fait nous sembler, aïe aïe aïe. Semaine en main, main en main. C'est ça qui fait nous sembler. Aïe aïe aïe. Bonjour tout le monde, nous quittons.
C'était un plaisir. Thank you, love you, merci.
You're welcome. Thank you, everybody.
Okay.